100% local control on public health is not a plan, it's a punt, and it's playing politics in a pandemic. Under the so-called plan, flexibility replaces responsibility. Yes, local schools need flexibility, but they need a plan. They need certainty. That's why today, after a lot of hard work with stakeholders, public health professionals, we have constructed a concrete reopening plan called Live Free and Learn Safe. And it's an actual plan. Our Live Free and Learn Safe plan calls for state-provided medical grade PPE N95 masks for all teachers in the state of New Hampshire. In addition, consistent with what North Carolina did, providing 5 washable, reusable cloth masks for every student in the state. If North Carolina can do it, New Hampshire can do it. A statewide mandate on wearing masks in middle school, high school, and on buses. A state assessment of all school buildings to make sure that we're provided proper air circulation and physical distancing, and building off of an existing annual air quality assessment done by the New Hampshire Department of Education. Using that assessment to springboard forward. Providing a standard for community spread levels that will trigger remote learning on a county by county basis. Providing a standard and an actual guideline about what happens when a kid gets sick. That's in this plan. It was non-existent in what we saw last week from Governor Sununu. Free COVID-19 testing for teachers on site at a minimum once per week, if desired. Statewide job protections for teachers that prefer remote learning, and paid sick days for teachers and faculty. In addition, training on anti-discrimination, because we know that Asian students are facing discrimination under COVID-19, and standing up our statewide mobile crisis intervention and stabilization team that we passed in Senate Bill 14 2 years ago, that has yet to been fully stood up in the operation at HHS. We need to make sure we take care of children's mental health as we go through this pandemic.
This is a critically important document, not simply for the education system. It is an important document that will chart what our health is going to look like in the future. This is a welcome guidance. It's the type of thing that a governor who wants to lead should do.
I don't want to fail my children in the fall. And if that means I have to put aside, one aspect of my life, I can put on hold because I have an amazing employer, I have amazing colleagues who will help me through that process. And I know that we are in a position that not a lot of people have, so I also recognize the privilege that I had in being able to do that, because not everybody has that ability. But I can't juggle 3 different schedules, because right? I've got 3 kids, every kid's gonna have a different schedule, right? I'm gonna have one kid who's at school, week 1 kid who's at school week 2, and nothing is gonna be consistent. So, if we had to stay home in the fall, it would be a great burden to me and my family. But by the same token, going back to school full time, I know is not gonna happen, and it's not gonna happen because there's not a way to keep people safe. And so really all I want is a plan so that I can plan.
I believe that Manchester should be 100% remote, that teachers can teach remotely from their classrooms if they're comfortable with going in the building. And as Emma said, then everybody would have a plan, everybody would know what's going on. Other districts are probably going to be a different story, and that's where, when Dan talks in his plan about pulling apart and saying, okay, let's look at these places, because the hotbed of Manchester and its surrounding towns are all going to be very much at risk. There's constant movement between all of these places, and it's, I think if the state had at one point stepped up and basically said, everybody stay home for 4 weeks, the end, we wouldn't be having nearly as much of a conversation about this right now.